Hello, my name is Carl Bush with Great Lakes Seminars, and I'm the instructor for our complex pain course. The reason that we decided to make this course is that we saw a need. And the need was when we have patients that you really don't know what to do with, patients that come in, you don't really know where to start because they're so complex. You end up trying a few things, nothing seems to work. You quickly run out of ideas and you don't know what else to do, so you end up passing them back to the doctor. And unfortunately, these patients go and see many different healthcare providers and no one seems to know what to do with them. So what we want to do with this course, and why I love it, is that we show you exactly how you should be evaluating and treating these complex pain patients. And by complex pain, I mean that the central nervous system has made changes over time, these pathological changes that either make the pain worse, maintain the pain, or it could be creating pain from something that really shouldn't be generating a pain response. We know from the Understanding Pain course that all pain is generated in the brain, but a lot of times we have things like cortical smudging, which I go over in the class, and that's where the brain actually loses a map of the rest of the body or a certain region of the body and starts to neglect it. That can generate a pain response. We have things like premotor pain, and what that is that the brain is actually stuck in a loop of anytime we have a certain motion, the brain thinks that motion is threatening to us and causes a pain response. But that means that even thinking about doing the motion can cause that pain response. So how do we treat that? We also talk about central sensitization and how we can improve this. We talk about how the brain, through different changes that it makes, can create systemic inflammation in the rest of the body, and that can lead to a lot of problems like fibromyalgia. So why I love this course, I love teaching it because it's almost all new information for people. And that's great for you because anytime you have a course that's very little review, that means a lot of new information, a lot of new techniques and skills that you'll be able to pass on to these complex pain patients. And hopefully you'll be able to improve the way that these patients go through your program and can get back to the things that they love to do. I hope to see you at a future course. Thank you so much.